NCLEX RN SATA exam prep questions updated 2026. Question 1.
When assessing a client diagnosed with impulse control disorder, the nurse observes violent, aggressive, and assaultive behavior.
Which of the following assessment data is the nurse also likely to find? Option A. The client functions well in other areas of his life. Option B. The degree of aggressiveness is out of proportion to the stressor. Option C. The violent behavior is most often justified by the stressor. Option D. The client has a history of parental alcoholism and chaotic, abusive family life. Option E. The client has no remorse about the inability to control his anger. The correct answers are options A and B and D. The client functions well in other areas of his life. The degree of aggressiveness is out of proportion to the stressor. The client has a history of parental alcoholism and chaotic, abusive family life.
Intermittent explosive disorder often features periods of normal functioning, aggression disproportionate to the trigger, and a history of family instability.
Question 2.
A nurse is caring for a middle-aged client who has undergone hemicolectomy for colon cancer.
The client has 2 children. Which concepts about families should the nurse consider when providing care for this client? Option A. Illness in one family member can affect all members. Option B. Family roles do not change because of illness. Option C. A family member may perform more than one role at a time. Option D. Children typically are not affected by adult illness. Option E.
The effects of an illness on a family depends on the stage of the family life cycle. Option F. Changes in sleeping and eating patterns may be signs of stress in a family.
The correct answers are options A and C and E and F. Illness in one family member can affect all members. A family member may perform more than one role at a time.
The effects of an illness on a family depends on the stage of the family life cycle. Changes in sleeping and eating patterns may be signs of stress in a family. Family systems theory posits that illness affects all members, roles are fluid, and the impact varies by developmental stage and stress manifestations.
Question 3. The nurse is monitoring a client receiving peritoneal dialysis and the nurse notes that a client outflow is less than the inflow. Select actions that the nurse should take. Option A. Place the client in good body alignment. Option B. Check the level of the drainage bag. Option C. Contact the physician. Option D. Check the peritoneal dialysis system for kinks. Option E. Reposition the client to his or her side. The correct answers are options A and B and D and E. Place the client in good body alignment. Check the level of the drainage bag. Check the peritoneal dialysis system for kinks. Reposition the client to his or her side.
Nursing interventions for poor outflow include checking for mechanical obstructions, kinks, bag level, and repositioning the client to shift the catheter.
Physician notification is subsequent. Question 4.
The nurse is caring for a hospitalized client who has chronic renal failure.
Which of the following nursing diagnoses are most appropriate for this client? Option A. Excess fluid volume. Option B. Imbalanced nutrition, less than body requirements. Option C. Activity intolerance. Option D. Impaired gas exchange. Option E. Pain. The correct answers are options A and B and C. Excess fluid volume. Imbalanced nutrition, less than body requirements. Activity intolerance.
Chronic renal failure leads to fluid retention, excess volume, metabolic disturbances affecting nutrition, and anemia/waste buildup causing fatigue, activity intolerance.